My name is Lisa and I'm from the Philippines. I am a pediatric resident doctor in one of the local hospitals here. I'm currently training under pediatrics. However, um, due to my difficult pregnancy, I had to take a leave of absence for the entire year. Um, I want to do this vlog for my um, future children so that they would know the journey that I went through during my pregnancy and all that. I'm inspired by the moms of YouTube like JP Sue's Beauty Isn't Everything, Lauren Layton, and others to make a vlog because there aren't any vlogs um, made by Filipino mothers. So I want to make this so that I can somehow uh, help other mothers from the Philippines um, with my vlog or experience. Um, Currently, I am 5 months pregnant, and as I've said, I have been having a difficult pregnancy. It started when I was about 1.5 months pregnant. Well, first, I learned that I was pregnant at 4 weeks. Um, I missed my period for 3 days, and I had an inkling that I was pregnant. The night before I tested, I was on call at the emergency room and I saw a patient with a lot of rash, and I got scared because I was thinking that, if I'm pregnant, then I should know at once because I am being exposed to patients who are um, very contagious. So the next day after my on-call duty, I tested and it was positive. So I know it's not the best way to tell your husband about it, but I called my husband, who is also a doctor, and he was at another hospital working. So I told him, there are two lines. so so there. So anyway, going back to my story, at about 1.5 months of around 1.5 months, um, I had bleeding and severe uterine contractions, and my obstetrician said that I might be having either a, a threatened abortion or an ectopic pregnancy. So I took a transvaginal ultrasound, and thank God it wasn't an ectopic pregnancy. Um, but it was of a questionable viability because the fetus did not have any heartbeat at that time. And then 2 weeks later, I had to undergo another ultrasound, and it was to our delight that there was already a heartbeat. So I went back to work, and being a pediatric resident, I was always on my feet. So I again had bleeding and severe uterine contractions. So another episode of threatened abortion. And my obstetrician said that you should take a leave of absence from work until you deliver because you're very prone to have preterm delivery. So basically, since my second month of pregnancy, I have been on bed rest. I am currently on my 5th month of pregnancy. I still get painful uterine contractions every now and then, but not as frequent as I used to before, which is good, which is very good. Um, so there. We had our first 3D ultrasound to determine the gender of our baby at 17 weeks. And however, it's 17 weeks, it's still small, but let me show you the picture that was taken at that ultrasound. I hope you can see it. That's our baby. So the OB said it's probably a girl, but she's not sure because if it's a boy, then you know that it's really a boy. But if it's a girl, then since it's only 17 weeks, you're not 100% sure. So we went back for another 3D ultrasound, and here it is. It's a baby girl. I really want a baby girl because since I'm on bed rest, I'm always on the internet searching for cute baby clothes, and there's so many cute baby clothes for girls, so I wanted a baby girl. But of course, a baby boy would be welcome as well. But yeah, we're having a baby girl. So regarding my pregnancy, I have been gaining a lot of weight as expected because I only stay in bed, and the only activity that I get actually is watching TV, watching YouTube, searching the internet, and of course eating. But I have ventured into sewing a few things for the baby, which I'll make another video for that and post it here. I'm told that I should be watching my weight. We have a family history of diabetes, and I am at risk of having diabetes. Uh, Actually, I had my blood sugar tested a few weeks ago because I noticed that I have been frequently urinating, so I ordered myself a urinalysis. And in our urinalysis, I had an overflow of sugar in the urine, so I had to take the oral glucose challenge test. And the cutoff is 130 milligrams per deciliter, and mine was 128. So it's kind of borderline. So I've been trying to avoid sweets, sugar, but sometimes, I don't know, I give in sometimes. I will have another blood extraction for the oral glucose challenge test and see if I need insulin or something. Hopefully not. So that's just about it. I just want to show you my belly, like what all other pregnancy vlogs show. They show their belly. So I want to share with you my 20 weeks, exactly 20 weeks today, belly. That's my belly. So that's it for now. Bye.